Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Fedway Associates, Inc., the Russell Berry Foundation, and by Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Adubato, coming to you from Philadelphia, the city of brotherly love. Why are we here? We're here, as you can see from the sign behind me. This is the Healthcare Collaboration Summit, brought to you by Virtua and their partners at CHOP, the Children's Hospital of Philadelphia. Just a few minutes, this room, this huge room, will be filled with over 200 people from across the nation, not just New Jersey, not just Delaware, Pennsylvania, New York, but across the nation. People who care about healthcare, people who are consumed by the Affordable Care Act, the implementation of the Affordable Care Act, what it means to you, what it means to your family. The bottom line is we'll be talking to all sorts of experts, members of Congress, members of the federal government, healthcare policy experts, people in the healthcare world, hospital world, people who are dealing with this every day. These are interviews that are important, they are substantive, and they have a lot to do with your life and how it's going to change based on the Affordable Care Act, or as some people call it, Obamacare. It's an important program. You don't want to miss it. We're here with Rich Miller from Virtua, the leaders of this healthcare summit here in Philadelphia. Let me ask you, Rich, first of all, why this summit? Why Virtua playing a key role in coordinating and leading this effort?
I think what it is, Steve, we're really at the precipice of change in healthcare. And what I mean by that is the model of delivery of care is changing in the United States. And we're kind of leading it here. And we're trying to talk to the healthcare community about how to collaborate and how to do it differently than it's been done over the last 100 years.
Be specific. Tell us exactly what some of those initiatives are, particularly the ones you're most proud of, and the tangible benefits that patients and the overall healthcare system are deriving from that.
Right. Well, part of it is the cost of care is just exorbitant right now in this country. So part of the goal is looking at chronic disease and caring for chronic disease differently. And how do we do that? The goal is caring for people in the home environment and keeping them outside the hospital walls where the expense is significant.
How do you do that?
Well, you do that by bringing in care coordinators, primary care physicians, nurse practitioners, social workers, people that will surround the patient, especially chronic disease patients, identifying those patients with high chronic disease that visit our emergency room 7-8 times a year and saying, how do we get them to take their medication? How do we keep an eye on their weight gain, making sure we can keep things under control so maybe they visit us once versus 8 times.
But that's not just some episodic initiative. That is a campaign. That's an initiative. That's an ongoing effort that's got a name, that's got a brand, the whole bit, right?
Yes, it does. I mean, it's a population health approach.
It's called population health.
Health management, right? You're managing the patient inside their home, their walls of their home, and making sure that you're caring for them in a different way. Because a lot of people today really don't understand their medications, don't know how to take them, and end up not taking them. So, and then they end up back in the hospital. So we need to really change the delivery model, if you will, from hospital focus to home focus.
The other thing that's interesting is coming together here in Philadelphia. Rich and his team, we were talking a while back about this summit, this healthcare summit. I mean, there are leaders from across the nation. You've got members of Congress here. You've got, again, while we're doing this program, Rich, let's acknowledge and disclose there's a government shutdown as we're doing this program, which makes it challenging. Right. But again, members of Congress are here. You've got members of the state administration. You've got healthcare leaders. But that just makes it even that much more complicated. But there was no thinking, hey, let's not do this because the government shut down, because you got to move forward.
Well, there's the point of this is, Steve, there's a lot we can do without government intervention. I mean, there's a lot we can do in the delivery model of care that will change the paradigm. irregardless of what our reimbursement, what Medicare and Medicaid pays us. There's a lot healthcare organizations can do. The one thing we're talking about here is let's forget about duplication. If we can partner like Children's Hospital and Virtua do for the care of pediatrics.
Talk about that. The CHOP connection?
The CHOP connection. I mean, part of what
Children's Hospital of Philadelphia.
Yeah, correct. And they're partnered with us out in our Voorhees location in South Jersey. And that relationship really takes the best of both providers and works them together to provide better care to the patient. So we're caring for kids in our community that we can care for, and if the kids really have a significant need for pediatrics at a different level, we send them to CHOP.
So let's be clear on this. So that potentially provides better health care for the patients, particularly these children, and saves money. So devil's advocate, aren't you in competition with them?
Not really, because what they've decided to do is they're not going to provide basic pediatrics in our community that we can provide. So all the basic care for the care of the patient in South Jersey comes to Virtua. So typically in a competitive environment, Steve, they would come over, set up a tent, and provide care. So they would compete with us. They're saying we're not going to do that. We're going to let you care for the kids in your community. And again, if a child needs the care that we can provide in the city of Philadelphia, we'll helicopter them over the city and not duplicate that level of care.
We are honored to be joined by two very distinguished participants in this very important summit. Al Campanella, Executive Vice President of Strategic Business Growth and Analytics at Virtua, and Dr. Jeff Brenner, Founder and Executive Director of Camden Coalition of Healthcare Providers. Good to have both of you with us. Let's talk about this. Collaborations, partnerships. Doctor, let me ask you. You have been recognized nationally for the work that you are doing, recognized by many to be a model for your work in providing health care. Talk to us about the partnership between your organization and Virtua.
Great. One hospital, one clinic, one doctor's office can't fix the problems we have in healthcare. Complex, high-cost patients move around from office to office and hospital to hospital, and it truly is going to take an entire city to fix this. We've been working together with Virtua for years now and building out data infrastructure. Virtua is really, and Al, in fact, was a key help in helping to launch a health information exchange in Camden, which allows really a powerful model of data sharing. We have been working very closely in the Kyle Will Center, which is the outpatient family medicine office in Camden owned by Virtua. And it's really turned into, for us, an R&D shop, meaning that we've got to figure out what's the primary care model of the future. How are we going to deliver better care at lower cost to every Camden resident and really every American? And I think we're way out on the cutting edge in some of the things that we're doing together.
Let's talk about this, Al. A decision was made to collaborate with Jeff and his team. Why?
Well, we really believe in what the Camden Coalition is doing, especially under Dr. Brenner's guidance and leadership. We really believe that improving healthcare in the city of Camden and really in the region at large is a team sport. So we have to really work together with both Dr. Brenner and the other healthcare systems that are all deeply rooted in the city of Camden.
Let's talk about the other systems. It's so interesting because one of the themes that has clearly come out at this healthcare summit is that hospitals are working with other hospitals, particularly in places like Camden. And so the question of competition, if you will, Dr. Brenner, it's looked at totally differently, right?
Absolutely. I think at some point we're going to have to question the model of competition. Healthcare competition, competing hospitals have not really lowered price. Dense marketplaces often have higher prices. At some point we have to ask, how many NICUs does the city of Philadelphia need? How many ICU beds does the city of Philadelphia need? How many gamma knives? We have a lot of duplicate resources that we probably don't need. Back in the 70s, we did a lot more very thoughtful health planning, and we controlled capacity in a way that was, much better planned. I think we may get back to that at some point as we start asking harder questions. The economic model of a utility is probably a much better analogy for what we need in healthcare than a highly competitive marketplace.
Talk about that.
Well, along those lines, in the city of Camden, about 12 years ago, Virtua decided to repurpose its hospital in the city. So we transformed that facility into a full-service ambulatory facility. We have, as Dr. Brenner mentioned, a very large primary care practice there. We provide other services, podiatry, dental, and a few others, and as well as like a farmer's market during the warm weather months. So it's become a small oasis in that section of the city.
Yeah, but stay on this. The whole question of competition. Has it been difficult for you and your colleagues to say, you know what? For years, we've been competing head-to-head. We've had marketing campaigns to say, come here, come to our place. Don't go to their place, come to our place. We're better than they are. And then when it comes to providing quality care for the patients of Camden, those who need it the most, who've had access problems for years, in certain areas you said that model doesn't work.
Well, we're all in the same swimming pool, so to speak. And right now, I can tell you, between the various health systems in the area, lots of collaboration and discussion. And in fact, just this past month, the community-based needs assessment project was completed. That was a effort of 5 health systems, along with the public health departments in 3 counties, Burlington, Camden, and Gloucester counties.
That was to figure out what the healthcare needs are of the residents of 5 counties. And why was that so important? Why is that so important?
Well, it was important because it was a major step to begin a dialogue on how we can collectively address some of those issues. So one of the major issues in that whole arena is around behavioral health and mental health and addiction services. So as an outgrowth of that process, the various institutions are getting together and starting that dialogue.
Talk about that behavioral health piece, Doctor.
We're going to have to tackle this issue head on. The hospitals are being really overwhelmed by patients in crisis who aren't being cared for in an outpatient setting, and we've got to stop being so reactive and be much more proactive. But that's going to take a really thoughtful planning process. We're going to need to make sure that instead of psychiatric hospitals and crisis centers, we've got access to high-quality counseling and providers in the outpatient setting.
We are in Philadelphia, the city of brotherly love. I'm Steve Adubato. This is the Healthcare Collaboration Summit. It is co-sponsored by Virtua and CHOP, the Children's Hospital of Philadelphia, and the Chief Executive Officer there is Dr. Stephen Altschuler. And I want to thank you for joining us, Stephen.
Thank you very much. I'm glad to be here.
Let's talk about this. First of all, you came together with Virtua to sponsor and convene this event. Why?
Well, first of all, we believe that collaborations are critical for the future of healthcare, and if you look at collaborations in this region, you would have to say that the collaboration between the Children's Hospital of Philadelphia and Virtua is probably one of the most successful. It's really improved care for patients in South Jersey, and I think has allowed both institutions to put greater emphasis on high-quality pediatric care for the patients that they serve.
Give us an example of that. We were talking to your colleague, Rich Miller, and asked a similar question. From your perspective, break it down for the average patient, the average consumer says, okay, that sounds great, but what does it really mean to me?
Sure. So, if you look at healthcare, what we really try to do with Virtua is provide a continuum of healthcare services. Most of the care that children require can be done in the community close to where they live. And for South Jersey, that's really the Virtua health system. So one part of the continuum involves CHOP physicians who actually practice at Virtua facilities and are there to see patients in the community. It's only when a patient has a much higher acuity illness or needs services that are not available in the community that they're transferred to CHOP. So from the healthcare system's perspective, you provide the right care at the right place with the right provider at the right cost. And then for the two providers, we are able to use our healthcare resources more wisely. And so by sharing this responsibility, the community really benefits in the end.
It's really interesting. CHOP, the Children's Hospital of Philadelphia, obviously has a national and international reputation as being one of the best. Someone might ask, Doctor, with the reputation you have, with the brand that you have, why not go it alone, you say?
Well, we would say, we are a community resource. We are here to serve all the patients in the region. So for us, we want to do that in the best way possible. Working with an institution like Virtua, as I said, has really been, it's been important to us. We learn from each other. They're a fantastic institution. And ultimately, we provide better care for the community, and that's both our responsibilities.
So when it comes to Obamacare, the Affordable Care Act, the act that we are here, the law that we're here to talk about and try to better understand the implementation of, What would you say from CHOP's perspective, from your perspective as the leader of that organization, the most challenging aspect of the implementation of it has been to date?
Okay. So from a pediatric perspective, to date, there's really been very little impact.
Why is that? Is there something about treating children?
Yeah, so current time, most children in this region have some form of health care coverage, either through commercial policies or through Medicaid. So Medicaid is very effective as a vehicle for providing insurance for children in southeastern Pennsylvania and New Jersey. So right now, most of the impact of the Affordable Care Act will actually be on the adult systems. I think over time, as we see how many people leave commercial or employer-sponsored health care and moving to exchanges, that's where we might see the impact in terms of less revenue per patient. But in these early phases, there's actually been very little impact on pediatric health care.
We are pleased to be joined by Brandon Hull, co-founder of Cardinal Partners, and your organization is involved in IT, technology issues, but what is the connection between that and healthcare reform?
You bet, Steve. So, yes, Cardinal is a venture capital firm, so we're out there financing next-generation information technologies that specifically address the healthcare industry. Healthcare reform is certainly the biggest health event in healthcare in our lives, bigger than Title 18 and 19, the Medicare, Medicaid in the 60s, and it is driving fundamentally new business models for the different players in healthcare. So hospitals are having to behave more like insurance companies used to. Insurance companies are behaving more like providers used to, and doctors are trying to figure out where they fall in that whole new schema. All of these new relationships require new technology infrastructure.
For example?
Well, traditionally, if you're running a hospital, it's facility-based, and all the activities are happening within your four walls, and a kind of centralized command and control mainframe, if you will, infrastructure works pretty well for that. But if your charter is now taking care of thousands of people out in the community, out beyond your campus, well, that's a network challenge, and it requires a much more distributed, flexible, fluid, and non-centralized IT model.
That mainframe model doesn't work in the same way.
It just doesn't scale. The hub and spoke finally developed so many spokes that everything is black, and that doesn't work.
So how do you guys come in and help facilitate the change that is needed?
So our job is to look ahead at what these new business models are going to require and find emerging technologies that speak to that. So for example, telemedicine is a huge way.
Telemedicine?
Telemedicine, so think of this as encounters with physicians or other providers that happens remotely via Skype or over a phone consultation. The dirty little secret in physician practice, waiting rooms, for example, 30, 40, 50% of the folks, as Governor Rendell mentioned a little earlier.
Governor Rendell, who we talked to a little bit earlier, the former governor of the great Commonwealth of Pennsylvania.
Right. He was quite correct in saying 50% of the people in a hospital emergency room don't need to be in that emergency room. Well, what are the relief valves? They're there, though, because it's late at night. Nothing else is open. So what are some of the relief valves we can give to give people the care they need in a lower cost setting? Telemedicine is one of them. How about a first step? We pick up the phone and have a phone consult and be triaged by that doc to the appropriate level of care.
So that's one example of how technology helps facilitate patient care, reduce cost, have the emergency room not be as crowded as it would otherwise be. Another example of how technology drives this process. By the way, the Affordable Care Act does what to also force the need for technology to be engaged and involved?
Yeah, well, the Affordable Care Act, one of the main implications for cost control is that providers will be no longer paid in the future in accountable care organizations for the piecework they do, but paid a lump sum for an entire span of illness. This is a great incentive realigning tool to get providers thinking about the cost structure and about efficiency. So there's an economic motivation to do things like I just described, triage patients to the low cost, high quality, the lowest cost, highest quality site of provider that they need.
We were joined by Stephanie Feldrich, who was with Virtua, the Vice President of Strategic Partnerships. You know, we're talking about partnerships and collaboration throughout, and you've had a panel discussion today, and you brought people together. These partnerships, first of all, what are we talking about, and why are they so important, Stephanie, when it comes to healthcare reform?
Well, with all the changes in healthcare, we want to approach partnerships in a smart and thoughtful way. It's a huge responsibility to take care of the health of a population, and really no health system can do it alone. So as we look to see where we might have gaps in care, where we could enhance access to care, provide that right level of care at the right place, time, and cost, partnerships are an opportunity to help meet the health and wellness needs of our community by working with other organizations.
Give us an example of that so people watching right now on public television are saying, that sounds great, no one's going to be against that, but I like my hospital, I like what they do, can't I just stay with them, you say?
Well, we have a few different examples. With Samaritan Healthcare and Hospice, they offer palliative care and hospice care, which is a service that Virtua does not provide, and yet we know it's really important in the continuum of care that our patients have access to those services. So we have a partnership that we work together to try to really integrate those services to help meet the needs of our patients, overall improve the experience for our patients, help to support our providers, our physicians, offering palliative care.
So hold on. So the idea is we don't have that, they have it. Let's help our patients because they have it.
Exactly. So that's if you were to look at a service that we don't offer, they have it, and that's where the partnership comes together. Another example with the Children's Hospital of Philadelphia. We started our relationship with CHOP and really looked at having them contract for pediatricians in the inpatient emergency department and our PICU and our neonatology units. We've evolved in our relationship that now they've really expanded the number of specialists in our community. We've partnered together on a pediatric imaging unit as well as a pediatric sleep center. And so families in our community don't have to travel far for that care, that specialized care that otherwise they'd have to be traveling for.
We're here talking to Terry McCarty, Senior Vice President and Director of Credit Management for TD's Healthcare Financial Services Group. Now that is a complicated title, but what it ultimately comes down to, Terry, is you're dealing with what?
We're dealing with basically your institutional providers, your hospitals, your skilled nursing, your large physician practices, et cetera, basically provider-based to the citizens of the U.S.
Now again, Virtua and CHOP have come together to bring healthcare leaders from across the country here to Philadelphia. Why a summit like this? And why is the cost side of this so critically important?
I think it all combines in healthcare reform. The Affordable Care Act is very important. The financial ability of all these hospitals and systems to actually deliver the care to the residents that are needed. I think collaboration is the big key today, as they have in their title. And we believe in healthcare reform. We also believe in the joint ventures between all the providers to make sure that every citizen has the care that they need, which, if you look at the Affordable Care Act, basically says it's a right. And,
but back up, I'm sorry for interrupting, back up a little bit. We talk about collaborations. The word collaboration gets used a lot. In a case like this, when you talk about healthcare providers, Virtua at CHOP, what does that actually mean, and how does it actually translate to cutting costs?
Well, basically, not everybody can do everything, right? So we need to all have our specialties. We need to move patients throughout the system.
Give us an example. So you're actually talking about reducing services by combining efforts so that not every hospital does the same thing?
Not really on that line, more on the physician and the hospital basis, for example. Joint ventures in outpatient surgery centers, where we can get the volume out of the hospital to take care of the really sick into the hospitals, but we can do the daily procedures outside. So collaboration between the hospitals and the physicians, things like that. Coordination of care, companies like QuaCare, which coordinate with the hospitals and the insurance companies on coordination of care to reduce the overall costs while making sure the patient has everything they need.
You know, it's interesting. People talk a lot about costs. You know, everyone wants to contain costs, and a lot of rhetoric around containing costs. Terry, what's the biggest challenge we face from your point of view in actually containing costs? Everyone says they want to do it. No one disagrees that containing costs is something that, you know, you don't want to do. Everyone wants to do it. Biggest challenge we face?
I think the biggest challenge we face is that every American has the feeling that they have the right for the best of everything. And I don't disagree with that.
Cadillac coverage.
Cadillac coverage, absolutely. And I don't disagree with that. However, we have to come up with a system that allows everybody to get that, but we can't bankrupt the country over it. So we need to coordinate everybody within the system, physicians, insurance companies, providers, and the residents themselves, to make sure that they get the maintenance coverage, that we're not going to not go to a doctor for 3 years and then all of a sudden have a large illness. So it's maintenance, it's prevention, it's the way you live your life. And I think those things all need to be coordinated.
We're here with one of the conveners of a very important panel, Annette Catino, the CEO of QualCare. Annette, put in perspective your panel, why it was so important to this important discussion.
Well, it's all about collaboration, collaboration between hospitals, physicians, and patients. And it's all about how we're going to take the data, the history of a patient, and put it into a perspective so that a physician who historically never knew what was going on with the patient outside of his four walls knows this information and can engage the patient in an active discussion about health care, about what's going on with the patient and how to help the caregivers deal with whatever issue that patient is having.
How the heck does that actually improve the quality of patient care?
Well, patient care is all about engagement with the patient, engagement with the caregiver of the patient. And it's all about a doctor having information at his fingertips to put
his or her
to put in perspective what's been going on with you in your healthcare system. And right now, Medicare is encouraging providers across the country to work with Medicare patients on what's called accountable care, and so that they have.
What does that actually mean? I always hear these ACO. Is that an accountable care organization?
It is, but it's a name of an organization that really encourages collaboration amongst physicians, hospitals, home care agencies, long-term care facilities, pharmacies, the whole gamut of the healthcare delivery system. And what it does is it says, we want you to take accountability for Steve Adubato's care, from soup to nuts, from every time he sees his primary care doctor to every time he goes into the emergency room because he doesn't know what's going on with his care or condition. So that's what it's about, and giving doctors the data that puts Steve Adubato in perspective helps him make better decisions for you and your.
Who's responsible, though, with all these people involved in the ACO, the Accountable Care Organization? Who's ultimately responsible?
Your primary care physician, the physician who you see most regularly for normal health care issues, not the cardiologist that might be taking care of your heart disease or the nephrologist that's taking care of your kidney disease, but your primary care physician who is charged with taking care of your global health and taking care of all of Steve Adubato, your spiritual, your mental, and your physical health.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, New Jersey Manufacturers Insurance Group, PSE&G, Fedway Associates Inc., the Russell Berry Foundation, and by Cone Resnick. Promotional support provided by the Star Ledger and NJ.com, and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.